Welcome to Pharmacology. These are all the main topics of pharmacology. Let's start with the first topic here, general pharmacological principles. Okay. So what and all we will be studying in pharmacology? Let us look at that. Mainly pharmacology is the study of the drugs, the medicines, correct? The actual medicines. So under pharmacology, we have the general pharmacological principles, where we will study the routes of administration, etc. Drugs acting on autonomic nervous system. Autonomic nervous system, like you have the cholinergic drugs, anticholinergic drugs. That is, this cholinergic is nothing but parasympathetic. Then you have the anticholinergic or the parasympatholytic drugs. Then you have the sympathetic drugs or the adrenergic drugs. Then you have the sympatholytic drugs or the anti-adrenergic drugs. Okay, so 4 categories here. Moving on, you have the autocoids chapter, in which you will read histamine, antihistamine, serotonin, that is 5-hydroxytryptamine, correct? Then you have prostaglandin, leukotrienes, non-steroidal anti-inflammatory drugs, that is NSAIDs like aspirin. All those will come in this chapter. Paracetamol is not an non-steroidal anti-inflammatory. It is not an anti-inflammatory drug, but we will read about paracetamol also. Then you have the anti-rheumatoid and anti-gout drugs. Then we will look at the respiratory system drugs. Respiratory system drugs, you can guess: cough, asthma, drugs for cough, drugs for bronchial asthma, right? Hormones and related drugs. Hormones means anterior pituitary hormones, thyroid hormones, insulin, corticosteroids, androgens, estrogen, progestin, oxytocin, drugs for calcium balance. All these are hormonal drugs related to that. Then we will go to the peripheral somatic nervous system. There we will learn about the skeletal muscle relaxants, local anesthetics. Local anesthetics, they have put it under the peripheral somatic nervous system. Under central nervous system, you will get the general anesthetic, okay? So general anesthetic, ethanol, methanol, sedative hypnotics, all the benzodiazepines, everything will come here. Anti-epileptic drugs, anti-Parkinsonian drugs, mental illness, that is antipsychotic, anti-maniac drugs, antidepressant, anti-anxiety. All of these are working where? Central nervous system. Then you have the opioid analgesics. Those were non-steroidal anti-inflammatory drugs which were working as analgesics. Then you have the opioid analgesics here. Morphine will come here. Okay. Then you have the CNS stimulants, cognition enhancers to increase memory and all that. Then let's move on to cardiovascular drugs. Cardiovascular drugs, you have to reduce blood pressure, the renin-angiotensin system, plasma kinins, cardiac glycosides, heart failure drugs, anti-arrhythmic drugs, anti-anginal, anti-ischemic drugs. Then you have the anti-hypertensive drugs. Maybe you will be very interested in the anti-hypertensive drugs, beta blockers, clonidine, okay? Anti-hypertensive drugs, very usual nowadays, right? Beta blockers, clonidine, etc. Moving on, kidney. Diuretics, antidiuretics. Diuretics, they will make the urine more dilute, more water loss. So the blood volume will decrease and blood pressure also will come down. So that is how diuretics also help in maintaining the cardiovascular system. Antidiuretics will help in increasing the blood pressure. Correct? For treating diabetes insipidus, you will need these antidiuretics so that you don't lose much of water. Blood formation, blood and blood formation drugs. You have hemantinics, erythropoietin, coagulation and bleeding. Like how would you treat hemophilia, etc., right? Then what about hypolipidemic plasma expander drugs? Hypolipidemic drugs, plasma expanders, all these are also going to be dealt with in pharmacology. Moving on to the gastrointestinal system, the drugs related, you can think, what will you try to treat in gastrointestinal? Diarrhea, constipation. Exactly. Peptic ulcer, don't forget, even you want to treat peptic ulcers, emesis, digestive disorders, reflux like gastroesophageal reflux. When you have the constipation, diarrhea, you want to give some purgative for constipation, laxative, purgatives for constipation, anti-diarrheal drugs. Then coming to antimicrobial drugs, you have the sulfonamides, beta-lactam antibodies, tetracyclines, chloramphenicol, aminoglycoside antibiotics like streptomycin, gentamicin, macrolides like erythromycin, lincosamide like clindamycin, glycopeptidide vancomycin, antibacterial antibiotics, urinary antiseptics, antitubercular drugs, antileprotic drugs, antifungal drugs, antiviral drugs, antimalarial drugs, anti-amoebic, antiprotozoal drugs, anti-helminthic drugs. Chemotherapy of neoplastic disease. So then you will study chemotherapy, anti-cancer drugs, miscellaneous drugs like immunosuppressants. That's nothing but something like corticosteroids, but something else, I think. Immunosuppressants, dermatology drugs like skin, mucous membrane drugs, antiseptics, disinfectants, parasiticides, chelating agents, vitamins. Vitamins are also drugs, right? Vaccines are also drugs. So basically, we will read all these drugs, their mechanism of action, the uses, the adverse effects of these drugs, a lot of things, okay? And for every disease, you should know the first line of treatment, what is safe in pregnancy. Lot of things are there to learn. I think for now, as an introduction to pharmacology, this much is enough. Welcome to pharmacology again. Please join and watch the videos to know the details of each of these.